You're watching the Wellness Hour, news that makes you healthier. I'm Randy Albers. Today's topic, if you are on Medicare, if you're 65 years and older, you got to hear what my first guest has to say. They are doing Medicare differently. With us, we have Dr. David Hatfield. Dr. Hatfield, welcome to the program.
Thank you, Randy.
Now, for people that don't know your centers, I guess you have more than 9 and growing, spread across Arizona?
We are. We started with 4 centers just over a year ago, and we are now at 9 centers and still growing.
Who's your typical patient?
It varies. It could be somebody that comes to us just with their Medicare benefits and they haven't explored any other options.
Okay.
And we also will have folks that come to us and they may be unhappy with their current Medicare Advantage plan that they're on or their current Medicare insurance that they're receiving, and they're looking for options. They want to know what else is out there and how can I get more benefits, more out of my Medicare.
Okay. Now, people need to know, we've talked about this on the phone, that not all Medicare providers are the same. Not all primary care physicians that are taking Medicare are the same. And you say you have the luxury of spending more time with patients. Tell me about that.
We do. At Hatfield Medical Group, we align with payers that pay us differently so that we can be more focused on preventative measures and quality outcomes.
Okay.
By doing this, it allows us to be able to spend more time with our patients. Patients want more time with their doctor. They don't want less time. I hear it all the time from my patients that they've left a doctor because he didn't have time for them. Time is of the essence. People today, especially seniors, need their healthcare needs tailored specifically to them, and they need time. They need to be heard.
Well, how are you able to do it differently? I mean, you're reimbursed based on how many patients you see. Is that correct?
So that isn't correct.
Okay.
That used to be how we were reimbursed, and that has changed. We've had discussions with payers to align with models that now pay based on how well we take care of patients. We like to say in our business.
What do you mean, like keeping them out of hospital?
Yeah,
Okay.
yeah. Prevention is the key. Keeping them out of the hospital, getting them the right care at the right place at the right time, which oftentimes means that folks want to be seen where they have a relationship with their primary care provider and they know that he will take the time to listen to them.
So your reimbursement is different than most primary care doctors handling Medicare. I want to make that clear.
It is. We
because
like to say
you get paid based on keeping them well.
yes, and
That's your reimbursement.
That's absolutely true.
Okay.
We like to say no outcome, no income. Outcomes refer to how well we take care of the patients, how well we do prevention, how well we educate, inform our patients, how well we keep them out of the ER for unnecessary visits that they don't need to be seen in the ER for, that they can come see us.
One of the things you told me on the phone, because you have a family of medical doctors,
Yes.
that you and your brother, who you work with today, you thought you were practicing good medicine. Tell me, or you thought you were good doctors, but you said you had no proof. What does that mean?
We had a growing, thriving, wonderful practice with great patient feedback.
Okay.
But we had no way to quantify how well we were doing when it came to quality metrics for our patients. We had a growing, thriving practice, and people gave us feedback that they loved coming to see us. But we really didn't know
If they're getting better.
if they were getting better. We didn't have data.
Okay.
Today, data drives every decision we make in our medical group, and it helps
And what do you mean
us-
data? Like what kind of data? Like what do you keep
Healthcare
track
data.
of?
So healthcare data. How well is Hatfield Medical Group informing and educating their patients to go get mammograms,
Okay.
to control their blood sugars, to go get colorectal cancer screening, to use us instead of the emergency room, to prevent readmissions to the hospital. So something as simple as if a patient of ours goes to the hospital, we have a transitional care management team. They'll reach out to the patient while they're in the hospital,
Okay.
schedule a follow-up with us in the clinic, and we'll see them in the office to ensure that we reconcile their medicines, if they need to see a specialist and follow up. But there's data around that tells us how well we're doing that, because if they don't bounce back to the hospital and they get in to see us and we
Okay.
keep them back out of the hospital, there's data.
So you keep stats. Let's say 9 doctors that work for Hatfield Medical Group. 9 doctors. Each one of them, you'll know that one of them their patients aren't coming for their annual visits or aren't getting their colonoscopies or aren't getting their mammograms. Is that true? I mean, do you kind of keep statistics even individually to the doctors?
We do. That's the nice thing about electronic medical records today. And that's the difference is earlier, my brother and I, we were doing on paper charts. Hard to capture data that way. Okay. Now we can get data in real time through our electronic medical records. And in fact, our physician scorecards that we use to kind of get a look-see into how our providers are doing are real time from our electronic medical record system that help us and give us teaching and coaching opportunities, how to help our providers do best practices to educate and inform our patients and help them align with some of the metrics and preventative measures that we want them to do that are so important.
Your father, didn't he found this? He founded this group?
He did. My father was a old school family practitioner, and he started back in the 1960s. And he was a solo practitioner. Back then, my dad was jack of all trades. He did everything. They delivered babies. They managed patients in the hospital. And it was founded on relationships. So you knew that you could call him morning or night, and he would respond to the phone call and either have you follow up in the clinic the next day and be seen, or he would get you the medical care you needed at that time. My father today would have been considered what we call a concierge level doctor. Concierge doctors, as we know, they accept a fee for a patient to be able to have access to them around the clock.
It's like having your own doctor.
It's like having your own personal doctor where they're at your beck and call, so to speak. And this is how my father practiced medicine. And then that kind of went away, and now we're bringing it back. But the interesting caveat is we're bringing back concierge level care without the fee.
And we should mention what we're talking, because look, we have doctors that come on this program that for like $5,000 or $18,000, they're your doctor for the year. And I kind of compared my notes with what you were telling me you're doing there, that you're able to do this in many cases at no charge, because Medicare Advantage pays for this.
So
is that right?
So not directly, but I often get the question from patients, Dr. Hatfield, how are you able to offer all these services? How are you able to see less patients, spend more time with me, and offer this concierge level care without the fee? In other words, they're surprised. Why aren't I being charged? In fact, many of my patients will leave practices where they were being charged that concierge fee to come to me because they don't want to pay the fee. And then they're surprised to learn we don't charge the fee, but we give the same services and more.
Because you might spend an hour with a patient on the intake. Is that correct?
Oh, absolutely.
Okay.
Yeah, absolutely. We can spend as much time as the patient needs to be able to answer their questions and go over their medical history.
Now, typical primary care, Medicare, they see about 40 patients a day. You say that you see like half that. Is that right?
Yes. It's simple. We're paid differently. When you are paid for volume and how many patients you see in a day, you're going to see volume.
Would you say that 95%, and I know these aren't exact statistics, but 95% of all Medicare providers are paid based on volume of how many patients they see?
Yeah, I don't know the data either, but I can tell you. Is
that the majority? Would you say the majority?
Yes, that is by far the majority.
And you're paid by keeping people out of the hospital?
Yes.
That's your reimbursement?
Our contracts are aligned with the payers as such that as we take better care of the patients, do our job of preventative care and keeping folks out of the hospital, where it's the most expensive place for people to receive care, the health plans reimburse us accordingly.
Is it a hassle? So somebody's watching this, they're 65 plus, they currently have a Medicare doctor they're going to, but they're frustrated. Maybe it takes them 2 weeks to see their doctor or to get a test or whatever. How do they make the change over to you? Because it seems like the paperwork would be a bit of a hassle.
It's real simple. If you're unhappy with your current provider or your current medical clinic that you visit, call us. Visit our website. Come take a tour. You don't even have to actually schedule an appointment. We'll let you tour our clinic. Ask questions. Find out a little bit. We actually have dedicated patient service coordinators that are experts in Medicare, that are in each of our clinics that will answer questions around your Medicare benefits. And these folks, they know everything from soup to nuts about Medicare. They know Part A, which is the hospital piece, Part B, which is the outpatient piece. Part C, Medicare Advantage. Part D, the pharmacy piece, right?
Okay.
That's enough to confuse the normal person out there. Wait a minute, Part A, Part B, Part C, what do I do? How do I choose it? Well, our patient service coordinators help our patients and their family members. And they'll help with the paperwork, right? We want to make it easy for them. And so we support them and help them at every turn to navigate through this, the Medicare piece.
Okay, now you have enough doctors. If somebody calls with a problem, can you see, and they want to see a doctor, could you see them the same day, the next day? Are you doing telemedicine? Tell me about that.
So 100%. Our whole model is built on that when I call the doctor, I want to be seen.
Okay.
Particularly when I'm sick. Now maybe it's a well visit and you might say, hey, I'm okay scheduling it out maybe a week or two. But if I call the doctor and I'm not feeling well, I want to be seen within a reasonable time frame, right? That's not too much to ask. And so we open up our schedules as such to be able to accommodate that workflow for our patients. We offer same day and next day appointments. So I'll give you an example of a typical patient that might call our office.
Okay.
Kathy calls, wants to be seen. She's complaining of urinary symptoms and is worried because the last urinary tract infection that she had, it went south and she ended up becoming very sick and had to seek care in the emergency room and maybe was even admitted to the hospital. And so she wants to get out in front of it. She calls our office, and if you're a typical medical clinic and you tell her, hey, I'll see you in a week, what is Kathy thinking right away? She's like, a week? Not only will I wind up in the emergency room for treatment and maybe in the hospital again, but could be worse, right?
Yeah.
So she wants to be reassured that, Kathy, let's get you in today and have that looked at and make sure that she's evaluated and treated, the right care at the right place at the right time. Most urinary tract infections are not complicated. And if they're treated early, you can prevent problems down the road. Kidney infection, infections in the blood that might occur from that. So she wants to be treated early. We want her to be treated early.
It's just a real comforting feeling knowing that you can call your physician in an emergency and they can say, come on in.
I like the way that as soon as I go into my Red Mountain facility, that the girls at the front desk know me. They say, well, hello, Mary Jo, how are you doing today?
Without Dr. Lewis and Dr. Ambrosia, I probably, according to what I understand, I would not be here right now.
Personalized care means that I'm not just going into the doctor's office and going into the room, the doctor answers questions, and then he leaves. The doctor takes the time to talk to me, and if I have any concerns, I write them down and I bring them with me, and then we go through them one by one, and he answers them. Having a care team is something new for me because they follow you, they know your history. So when you call and you have a question about maybe medication or something that the doctor's going to prescribe, you can talk to them about it and they can go through your file quick and tell you what you need to know. And it's something totally different, and I like that. Medicare and any of the insurances can be really hard. They take care of everything, so I don't have to worry about it. And if I do have a question, I can just call in and ask, and they'll let me know what I need to know.
So this style of where you get to spend more time with patients on Medicare and where you're reimbursed by keeping them well or out of the hospital, is this rare in Arizona? I mean, are there a lot of these popping up?
We're the only group in Arizona that I know of that is offering this type of service.
So for example, my sister, who's about to turn 65 in a couple of months, she's Googling Medicare and providers, and I told her a little bit about you, and we couldn't find anybody in San Diego doing this kind of like concierge medicine, customized medicine, where they spend more time with you out here. Do you think this is the wave of the future? In fact, I think, I don't want to quote, put words in your mouth, but something about this is the future of medicine, or this is the way it should be practiced?
Well, tell your sister she can move to Arizona, and I'm happy to accept her as a patient for sure.
Okay.
But folks today, they don't want to be put on hold. They want their healthcare problems, their medical problems, to be taken seriously. And they don't want to wait.
Okay.
People don't want to wait to be seen by their doctor. And honestly, for that reason, we staff our clinics that way so that we don't overbook. And we allow for, again, back to what we talked about, same-day visits and next-day visits.
And you have a team approach. So tell me about this team approach you have.
We have chronic care managers that help us be the eyes and ears of our providers when they're not in the exam room seeing the patients.
Okay.
These chronic care managers do everything from help our patients control their diabetes, make sure that they're taking their inhalers for COPD or emphysema, make sure that they're getting in to see their specialists on a regular basis. They even help us with prevention. They'll even help educate and inform our patients where to go to get screening exams and prevention exams, such as mammograms, colorectal screening, and other exams.
You're big on prevention. You also take care of very sick people, but what do you do for prevention? Because that's challenging to get people to do it, to go to their checkups and do all this stuff.
It is a challenge. We like to say in our medical group that an ounce of prevention is worth a pound of cure. Our philosophy that it is easier to stop something from happening in the first place than to repair the damage after it has happened.
Okay.
A good example of that is we see with our diabetics, they need to be screened for diabetic retinal eye exam or eye disease.
Okay.
Many of those patients don't have any symptoms. So prior to us investing in cameras to do that exam in our clinic, we would have to give patients a referral to go see an ophthalmologist.
Okay.
Many folks wouldn't go do it because they didn't have symptoms. So they're like, well, my eyes are fine. Why would I take time to go see the eye doctor? I'm doing fine. I see okay. They're not causing me any problems.
Yeah.
I'm good. So we invested in these cameras to be able to do the screening at the time of our exam. We do it when they're in the clinic at the point of care. Now, the importance behind that is a screening exam, by definition, you don't have symptoms. So
Okay.
we're catching it early. We're catching the problem before it is
Before they lose more and more
too far
vision.
down the road, before they lose more vision. And so this all-important eye exam, as simple as it might seem, to the person that we're catching diabetic retinal eye disease early, it means the world to
So I
them.
understand this correctly. Okay, so they go to Hatfield Medical Group, and let's say they have to see a cardiologist, or they have to see an internist, or the pain management physician. Are these things that you kind of manage and arrange for them, point them in the right direction? Tell me how that works.
Yes, we're the quarterback, right?
Okay.
So we kind of oversee their health care. And we make sure that when we do send them to a specialist, if they need to see a cardiologist, that specialist is in network. And it's somebody that we would send our own family member to. And we vet that through quality metrics, right? We want to make sure that the person that we're sending them to, entrusting care, is a person that we would go to ourselves.
For anybody tuning in, that Medicare and certain Medicare advantages, you can transition. There's no setup fee. Like if somebody is currently being taken care of, there's no setup fee that you're charging to switch over, that they have to pay out of pocket?
There is no setup fee. Our goal, we certainly accept Medicare Advantage and we accept traditional Medicare. Our goal is to, when the patient comes and sees us, we want to take care of them and support them with their health insurance needs. We want to support them with any mental health they might need. We want to support them with preventative screening and exams. And certainly we want to manage, as we know, a lot of seniors have chronic disease conditions. We want to help them manage those chronic disease conditions.
In Arizona, are there, would you say, tens of thousands of people that are eligible for Medicare? Are there any numbers on this? How many people over 65 there are?
So we know this about Medicare.
Okay.
10,000 people a day turn 65 in this country.
Okay.
Arizona, we know there are a lot of seniors.
So would you say there's or more than 100,000 people that could be taking advantage of what you're doing that don't even know you exist?
Yeah, I don't know exact numbers, but yes, there are.
So it's more than 20, 30,000.
There's no question. There's no question. There
that-
is a significant number of the population that should know that there is a doctor out there qualified to manage all of their complex medical conditions, but also support them with their insurance needs and their mental health.
Okay. On your website, I think I saw, stop searching, you have found the right doctor. You believe that?
We do. We believe that. We believe because of the time that we have to spend with our patients, because of the different services that we've put in place to help our patients get quality care and manage their disease conditions, we believe it.
I think you told me that a lot of people are using ERs, emergency rooms, as their primary care physician. That means they only go when they're really sick and down and out, need an antibiotic or whatever.
Yes, unfortunately, this is true. Many seniors that don't have access to care with their primary care provider will use emergency room services to treat things that could be very easily seen in a primary care setting and avoid an expensive emergency room visit that costs the patient money, time, and honestly can expose them to sicker people that are in the hospital because that's where the sick people
But
are.
these emergency rooms are open on the weekends and late at night and things like that sometimes. How are you able to handle that kind of thing? Are you connected with like urgent cares?
We are. We partner with urgent cares in the community. So when our primary care office is not open, we have an on-call service, and
Okay.
we certainly help patients navigate where they should go. We triage patients when our clinics are not open. I'll give you an example.
Okay.
I love, and I'll call him Steve for the purposes
Okay,
of the example. So a few years back, a gentleman, Steve, came to see me. And I asked him about his health care and how it had gone. And he simply said, I'm frustrated. Steve would utilize the ER as his primary care service. I mean, that's where he would go to show up for something as simple as a medicine refill. And so I sat with Steve and I listened to him. And the plain and simple of it is, there was no access to care in the clinic that he went to prior to coming and seeing me. Now, Steve had medical problems that needed to be addressed. That's why he wound up in the ER with frequent admissions to the hospital. I sat with Steve and I listened to him and I said, Steve, we're going to do this differently. We're going to restore quality of life back to you, and we're going to manage these disease conditions, for which some of them that he has, there's no cure, but we're going to manage them. And I told Steve, you're going to make an appointment every week with me. And I'm going to see you every week.
Wow.
Until we get this straight and figured out. And number one, we're going to build trust, because at the Hatfield Medical Group, we're all about relationships.
Okay.
I needed Steve to know how much I cared about him so that he would care how much I knew and start to trust me as his medical provider. So every week I saw him, and we started to keep him out of the emergency room because he trusted that I would be there for him, and that when he would call, he would actually be able to be seen. And that our chronic care manager started to reach out to him and have conversations with him about how well he was managing his diabetes, his COPD, his congestive heart failure. So real serious medical conditions that really warranted us to get out in front of. And then it backed off to, I saw Steve once a month, but no ER visits. And then now I'm seeing him once a quarter. Steve is our biggest champion. When I see him, if it wasn't, he would give me a hug. That's how much he loves what we have done for him. And it's not me, it's our model. It's the way that we view the interaction with patients at Hatfield Medical Group. We want to create time. We want to listen. Most importantly, we want to get them the right care at the right place at the right time. And for Steve, that was life-changing,
So
right?
if he sees you though once a week, is that a lot of out-of-pocket expense for him?
So it's not, because he's on a plan that allows him to be able to come see his primary care provider without out-of-pocket expense.
Okay.
Now, it was his time, but it's a whole lot less time than going to the ER every week.
So every once in a while, you have to really kind of take somebody like Steve and see them a lot to kind of shift the way they're eating, the way they're sleeping possibly, maybe move around some of their medications.
The goal is to keep our patients healthy and happy and out of the hospital, right? Nobody
And that's
wants
what
to-
you're doing, and that's
yeah,
what you're doing.
Yeah, nobody wants to go to the hospital. They would rather come see us in the primary care setting and manage all of those things. And because our doctors, again, back to this point, because our doctors have time, they take time to have discussions around lifestyle changes. How much are you exercising? Are you walking? Are you able to do the exercise that you want to do? They're able to have time to discuss nutritional advice, right? That's been gone in medicine for a long time because doctors have been so rushed and always behind. But our doctors have time to be able to have those all-important discussions around treating a
They've got to be
holistic
surprised
approach.
about this. I mean, the patients have to be surprised.
They are surprised. I can tell you that just last week, one of my patients was in to see me, and as typical, I asked my patients to do, she brought a list in. And she started to go down her list. And she got to number 3 or 4, and I saw that there were 3 or 4 more things on her list. And she goes, "Oh, Dr. Hatfield, you don't have time for me today to do the other ones. I'm just going to leave it at, we'll just take care of these top 3 or 4. And I go, "No, let me see your list." I grabbed it out of her hand.
Okay.
And I looked at it, I said, "No, we're going to take care of all these right now. And I'm going to get you the help you need. Because if it's important to you, it's important to me."
We are short on time, probably about a minute left. But is this kind of, I mean, do you look at it as like a cure for a broken medical system that we have in a way?
Well, we certainly think it's a start in the right direction. We think that it all begins with prevention and screening and managing chronic disease conditions, diabetes, congestive heart failure, high blood pressure, in the right setting, Manage them in the primary care setting where folks want to go, where people, they have a relationship and they know that they're going to be heard and listened to.
That's covered by Medicare.
It is covered by Medicare.
Final message, somebody watching this, they're 65 or about to reach 65, or they're currently going, I haven't heard of anything like this. They're 80, 70, 90, but they're still skeptical, or they're still hesitant to make the change or even look into it. What do you say to them? And what do you want them to know about Hatfield?
Well, I want them to know a couple things. Number one, my dad used to always remind me, "Son, you are what you do, not what you say you will do." We are delivering on our promise with data driven of quality, compassionate care to every patient every day. We're doing it. We're actually seeing the data drive our behavior to more quality care, more compassionate care.
Quality care means them getting out of the ERs and staying out of the hospital and being able to see a doctor immediately.
That's right. Yeah, that's right. And the compassionate care piece speaks for itself, right? It's just being a nice guy and caring for somebody the way that you would care for your own mother, right? So, and that's what we do.
I want to thank you for coming to the show. Good stuff. So if somebody wants more information, they can visit your website. Could they sign up there, or do you prefer to call?
We prefer a call. Go to the website, fish around a little bit, call the number. There's no obligation. You don't have to schedule an appointment. Just schedule a tour of one of our clinics, and we'll have one of our experts take you around the clinic, introduce you to the doctor. You don't have to sign up for us right there. Come see the proof in the pudding. Come see what we're doing, and you'll see when you walk in our clinics, it's got a different feel.
Good.
And you'll see smiles, happy doctors, happy support team, happy chronic care managers. Most importantly, you might even bump into a few happy patients.
Thanks for coming to the show. Good stuff.
Thank you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.